The Monroe County Department of Health says hundreds more people have tested positive for COVID in our area. 270 new cases of the virus are being reported today. The 7-day average positivity rate nearing 9%. Right now, 429 people are being treated for COVID in the hospitals across the Finger Lakes region. About 100 of them are in intensive care. All this while the nation braces for the latest COVID variant, Omicron. This version of the virus comes with some 50 mutations, meaning it could be more transmissible than the standard COVID virus and may be harder for some antibodies to fight. But all of that is still unknown. Jack Watson joins us live in Rochester. Jack, you spoke to medical researchers with Rochester Regional Health today about Omicron. What are they saying about this virus?
Well, John, many of us just found out about Omicron after the Thanksgiving holiday, and now medical experts are saying it is simply too early to tell the answers to many of the questions that we're wondering, including how effective is the vaccine against the Omicron variant, and how sick does it make people who are unvaccinated. This is a variant that was detected a few weeks ago and reported just a few days ago. The sample size is small, but there are concerns that it could be highly transmissible. It was first discovered in southern Africa and has since been found in several other countries, including Canada. And it's already prompted travel restrictions from several countries, but doctors are waiting for more results to emerge.
It appears to have be more transmissible. And there are at least, at last count, there were nearly 50 changes in this virus compared to the preceding strains. So it's those number of changes or those mutations that are of concern.
We really need to just get in the lab and take blood samples from people who are vaccinated, who have good antibodies, and see if those antibodies can in fact neutralize the virus and protect you from becoming infected.
Now, how much the new strain could put a strain on our daily routine still unknown at this point, but experts stress that vaccines do prevent new variants from coming about, and it's best just to get vaccinated in the first place. We are live in Rochester. Jack Watson, News 8.
All right, Jack, thank you. We are told that Rochester Regional is looking for the Omicron variant. Their labs are collecting samples right now. Today, Governor Kathy Hochul hosted a COVID-19 briefing to update New Yorkers on the state's ongoing pandemic response efforts. Friday, Hochul signed an executive order allowing hospitals to limit non-essential procedures, something she said will boost hospital capacity amid warnings of Omicron. Hochul says she and health experts in the state are getting ready.
Right now I wanted to talk about the new variant, which has been dominating the news. We are watching this very closely out of South Africa, watching to see whether or not there is a case here in New York. I said on Friday I fully expect it to arrive.
That is correct. We just checked the international sequence databases, the public sequence databases just a few minutes ago, and still nothing in New York, nothing reported for New York, and nothing reported anywhere else in the United States.
This week, Canadians taking short visits to the United States will have one less step to deal with during their trips. Starting tomorrow, Canadian officials say their vaccinated citizens will no longer have to return with a negative COVID test for trips under 3 days in length. U.S. travelers must still have proof of vaccination and proof of a negative test within 3 days before entering Canada, no matter how long they stay. We do have more information on Omicron, including the full news conference with Governor Kathy Hochul, on our website at rochesterfirst.com.